4-year-old boy presents with a history of recurrent bacterial infections, including several episodes of pneumococcal sepsis. His two maternal uncles died after having similar complaints. Lab investigations reveal an undetectable level of all serum immunoglobulins. Which of the following is the most likely diagnosis of this patient? Remember, he's a 4-year-old boy and he has pneumococcal sepsis episodes, multiple episodes. Two maternal uncles already died, so it's a congenital hereditary disorder. Your options are option A, common variable immunodeficiency, option B, hereditary angioedema, option C, celiac Higashi, option D, Bruton A gamma globulinemia, option E, Digeorge syndrome. Patient has recurrent history of bacterial infections, several episodes of pneumococcal sepsis. Okay, his two maternal uncles died, had similar complaints. Lab investigations reveal undetectable level of all serum immunoglobulins. Now, this itself is a dead giveaway that all serum immunoglobulins are undetectable. So, which of the following is most likely? Over here, we have hereditary angioedema is checked off, celiac Higashi is checked off, Digeorge syndrome is checked off, common variable immunodeficiency, we could suggest it, or Bruton A gamma globulinemia. Now, Bruton A gamma globulinemia is X-linked recessive. Since it is given that two maternal uncles died after having similar complaints, it is much more likely that it is a Bruton A gamma globulinemia. In explanation also they would have shown. No, they are not shown. Yeah, X-linked Bruton A gamma globulinemia.
Thanks for watching. Please give a thumbs up and subscribe for more.